and good evening all to you. The rain is disturbing us this evening. I'm hoping that more people will come, even though it's raining. My voice is a little bit queasy. I'm hoping that I will be as clear as possible. Let me just switch on this thing here. Okay. Is it on? Yeah, it's on. Okay. Good evening, everyone. I trust that you are well and you had a good day. This evening's topic is drug treatment and recovery. I want to assure you that every single person who's an addict has an inner desire to change. Do you know why? Because there's something that God has put into us to want to change even though we do bad. The consciousness, there may be a little bit of a spark there. You look at the person and you think to yourself, is this person even redeemable? Can this person change? But all they need is somebody to come and fan the flames, fan the spark, so that they can realize that yes, there is hope. It's difficult at the beginning, but I can tell you now, with my experience, that it is possible. So, recovery is actually a ministry of deliverance. How does deliverance take place? It takes the Spirit of God. It takes God to assist, because even on my own, even though I do clinical, counseling and so on, it doesn't mean that I have all the answers, because somehow the Spirit of the Lord must work through me so that I can help the person who I'm counseling. So it doesn't mean that the person will become, we are dependent on each other to actually make it through to that, towards that recovery. So, otherwise, and there's no point in recovering or going through recovering sessions or period without bringing the God factor into it through the power of the Holy Spirit. It is very, very important. Prayer is key to solutions for recovery. So what is addiction? Addiction is a complex but treatable disease that affects brain function and behavior. It changes the brain, the function of the brain and the way the brain normally functions in terms of normality in comparison to somebody who doesn't use drugs. I mean, obviously there's a big contrast as far as that is concerned. I want to show you these two images here. The image on the right, or rather on the left, is what you call, it's a normal, that's a normal. Can you see the colors there? You see the red in the center and then surrounded by yellow, and you see the spots of yellow there. That's a normal brain. That's how a normal brain should look like, right? And on the right is a drug use. Can you see the difference? The brain has been recalibrated, or how do I put it, has been restructured. Because that is what the drug does. So that is what you call, it says that this is, it doesn't necessarily have to be for somebody who smokes crystal meth like tip. It could be cocaine, it could be any other drugs, including crack cocaine, right? So those three images, you see the one on the far left? That's a healthy brain, similar to what you saw in the previous slide. And then in the middle, can you see the difference? How the person's brain has then become affected, the one in the middle. But after treatment, can you see that the colors come back again? That means that a person has gone through a process of healing. It takes at least 1 year. 1 year for your dopamine levels to fully recover into the brain. So it means that the program stretches long. It's not a 3-month program, it's not a 6-month program. It's a long-term program which afterwards we can then do which I'm going to talk about, the 12-step program. So no single treatment is appropriate for everyone. Treatment varies depending on the type of drug and the characteristic of the patient is concerned. So the type of drug has a certain way that it affects the person's brain and how that person become dependent on the drug, as well as the mental health conditions that comes with it. For example, temporary schizophrenia takes place where they start talking to each other, they hallucinate, they see things, and so on and so forth. And then obviously the paranoia disorder, as well as other conditions, depression, and so on and so forth. So not every single person is the same. So that is why in the beginning we do there's a certain kind of a exercise that I do. I call it motivational interviewing. I interview the person with a motivational technique, even though the person is not really sure whether they want the treatment or so forth. I then come up with a technique where I ask certain questions, and then on the basis of how you answer my questions, I then motivate you and I ask you certain questions so that you can at least have the ability to say that I think I can do it. But that goes with also a lot of prayer. In the beginning, it's very difficult. But it does actually work. Most of the time, 99.9% of the people that I meet for the first time, I do get it right to see them again. And I really thank God for that, because it's a humbling experience as well. So behavioral therapy includes, so what the treatment means is called behavioral therapy. In other words, we have to change the behavior of the person to go back to where that person was before the drugs, or even better. So it means that you have to bring the family in, okay? We have to bring a support system so that the person can experience that there is support for me. I'm not alone in this. My family loves me, even though I took all the AMC posts and the TV and this and that. But they still love me. And that is why the family needs to get therapy as well, because there's an experience that they've gone through. They've experienced the behavior of this person, and they have to now come back, and counselors are also peacemakers, because we have to make peace between the family and the drug user or the person that is recovering. So these are so as I said, the motivational interviewing and so forth, and building skills to resist the drugs. The building skills to resist the drug is referred to as prevention skills and so on and so forth. Okay, and then activities with constructive and rewarding activities. In other words, I now have to use certain techniques so that the person can feel good about themselves in the things they used to love. Because when you go on to drugs, the things you used to love doing, you don't do them anymore, like a hobby or anything that you were passionate about, because the drug takes all that away from you. Now you have to re-socialize the person. Bring the person back to who they used to be. Ask certain questions. What do you like? What is your hobby? What is your passion? So that you work that person back into that old, what that person used to be like. So the concept of behavioral modification, which is, it's also called cognitive behavior therapy. So behavior modification treatment methods involve redirecting behavioral patterns towards socially acceptable conduct, and also behavior modification methods can involve a single strategy or combine with a variety of different strategies in the counseling. So the model or the treatment model that is prevalent or that actually works is called a matrix model. It has a matrix of different methodologies and techniques that you can use to bring the person to where they need to be. So that is the matrix model. It has to do with relapse prevention, to avoid the person to relapse, and there are certain techniques that needs to take place there. And then there's also motivational interviewing, which I was talking about, and then psychoeducation. You have to educate the person about the drug, what it does, and how it has damaged the brain. But you also must educate the family, who they are dealing with. Remember last night? The effects of drug on the brain? So the families need to be aware of what they are dealing with. Sometimes when there's fits of rage, you do not have to also raise your voice. Be calm and collected, because that person is emotional. So you maintain a calm disposition so that the person can also begin to get, find themselves. So that is what the cognitive behavior therapy is, and those are obviously the other motivational, obviously I've spoken about the family therapy and so forth. And then lastly, the 12-step program. This is an outpatient program, all right? It is very effective because we come together as a group. Everybody shares their experiences of how they are recovering, their challenges and so on. And as you can see there, with the 12-step program, they have to surrender to God, to themselves, to the family, to the actual treatment itself. And then you give them hope, faith, honesty. You have to be honest about your recovery process, the things that you used to do and how you behave. You need forgiveness, and you need to also go out and make restitution with those that you have hurt. And obviously the willingness and to become humble again, so that your recovery process becomes, is seamless. In other words, it's just harmonious and so forth. Not all experiences are the same. There will be relapses. You just bring the person back and say, let's carry on. You relapse, but it doesn't mean that it's the end of the world. You were weak, but come, let us continue with the treatment and so on. So thank you very much this evening. I want to mention that if you need any kind of counseling as a parent because your child is on drugs, please see me. If you need anything else, your child, you want me to come see you at your home, I'm definitely available for that. Thank you very much.